Well, polio is close to being eradicated, and if we can keep the funding up and keep doing a good job on it, it'll become the second disease ever eliminated, and no kid will ever be paralyzed again.
How much money is needed?
The campaign costs almost $1 billion a year, and if we look at the next couple of years, we're about 700 million short. So we need to draw on more people and get this thing done. We're down to the last 1% of cases, but that's the hardest part.
Melinda Gates, the distinction a lot of people make between you and your husband when it comes to the Foundation's work is that he's obsessed with vaccines and technological answers, and that you're obsessed with the human dimension. Is that a cruel observation?
I think we're both obsessed actually with vaccines, if you want to know the truth. And it's because of what it does, though. It saves children's lives. When you say there are 8 million children who die every single year, many from vaccine-preventable diseases, and we know we can tackle those diseases, it makes me excited about getting those tools out to mothers so that they know they can raise healthy children.
But then you do need nurses, healthcare workers, you need infrastructure to make all this stuff work, to make the aftercare work, to sustain the campaigns.
You do need a delivery system, but what we're finding is that countries are investing in their own delivery systems. So, for instance, Malawi, where I was last year, one of the poorest countries in Africa, they're building out these healthcare workers, these women who go out into these very remote villages and make sure those children get vaccinated and that mothers get into clinic to deliver their babies. It's incredible.
Well, now we'd like to let our viewers ask you questions, and they've been tweeting questions all day. Bill Gates, with the amount of money the Foundation donates, how do you prevent corruption?
Well, what you want to make sure of is that you're having a big impact. And with vaccines, it's not that easy for corruption to creep in. There may be a tiny bit of it, but dictators don't like to stockpile vaccines. It's not that exciting for them. And you can measure where you're getting the coverage. And in fact, if somebody's not doing the job well, the diseases like measles or more polio will show up. And so we're working hard to make sure that health aid really has the big impact. And whether it's our money or the governments like the UK money, I can say that health aid really is not much affected by corruption. There's been some confusion about that, but believe me, I wouldn't put my money into it if we weren't sure about that.
Well, Melinda, the British government is going to be involved with you tomorrow on this polio campaign. You managed to crack them first. One wonders how, and whether you've managed to get anybody else. I saw President Sarkozy was around you quite a little bit behind there. Did you manage to get him to do it?
Well, I think the thing to highlight here is the incredible generosity of the UK citizens and the government, and the fact that the government ring-fenced this part of the budget so that it could be used for humanitarian purposes. It's just incredible, and I think their leadership will make other countries want to come into this immunization campaign all the more, and we will be calling on a lot more governments, and still are.
Well, let me ask you the next viewer's question, which was tweeted in. What are you doing, Melinda, to ensure that governments don't shirk their commitments to aid, as they may feel your commitments are enough?
Well, that's exactly what we're doing, is we'll put in our commitment and say this is what we feel like we should do as private citizens. And if we think our investment is this important, one of the things we've done for the Global Alliance for Vaccines and Immunizations is we made a second grant to that organization, a huge grant. So our whole commitment is $1.5 billion. But knowing that we were doing it to set an example for governments, because we can never scale this the way governments can. And so we're saying this is our investment, and if we feel this strongly about putting our own money, we think it's a good investment for governments to make as well.
Well, Bill, do you ever actually say to a government, I'm sorry, mate, we're not going to put anything in unless you do put something in?
Well, I think everyone is watching because when you're talking about vaccination, you're saving lives for less than $2,000 per life. And amazingly, by having healthy children, what it does is the parents decide to have less children. They know several will survive to adulthood. And so whatever issue you care about, stability, the environment, all of those, the thing we need to do is make sure that we don't have these population explosions. And so I feel good about the money we spend on vaccines and getting other governments to do that, even in times when budgets are as tight as ever.
Well, here's
And
a
I've
good...
just come back.
Sorry, carry on, Melinda, sorry.
I was going to say, I just came back from Kenya, and it's incredible to see this Alliance for Vaccines and Immunizations rolling out a new vaccine for pneumonial disease in Kenya. We know that pneumonia kills 1.6 million children a year. It's not just the money that comes from the alliance, from the donor nations, but also the Kenyan government is stepping up and putting their own money in and training their own workers to deliver this vaccine. So I think we see that whole countries are coming together and rallying around this cause, and that makes us really excited too.
Well, that takes us very interestingly to the very next question from Dr. Fouzia Sadiq. Do we just want a prophylactic drug, or do we really want to eradicate AIDS? What's your central drive?
Well, you have to be very careful which diseases you pick for eradication because that's very tough. Polio, we think we're there. This 2010 was a good year. With AIDS and malaria, right now, the tools we have should allow us to reduce the number of people who get sick quite dramatically. But with AIDS, until we have a vaccine that's highly effective, we won't be able to think about eradication. Now, we and others are funding that, but it could be 10 or even 15 years before we have that vaccine and we could put together such an aggressive plan.
But Melinda, wouldn't that money perhaps be better spent on behavioral change?
Well, I think you need to do both. I think what we need to say to people right today, and what we are doing as a world through things like the Global Fund, is saying to people, it's prevention is the tool we have today. Use condoms, practice safe sex, and until we can get the upstream tools like a vaccine, those really are our strongest messages. We can also do male circumcision, which we know brings down the rate of AIDS, and we can do a few other things like prevent mother-to-child transmission of AIDS. But it really, ultimately, in 15 years, it's really a vaccine that's going to change the whole face of that disease.
And Melinda, because you've just been in a malarial area, let me press you then on this next question from a viewer. What progress has been made towards wiping out malaria in percentage terms?
Well, we have a whole host of countries that are really taking down their malarial rate, whether it's Ethiopia or Kenya or other African nations, and it's because of the tools that we're getting out there. So we're starting to see local places that we can talk about eliminations happening by country. And again, it's because we're getting malarial medicines out there, we're getting bed nets out there, mothers are starting to use them. So those are cultural messages, getting moms and babies to sleep under them. And then ultimately, again, it's a malaria vaccine, but we have one coming in the next few years. So we can actually talk about, in my lifetime, eradicating malaria.
Well, now, Bill, even while we've been live streaming this on the web, somebody has just tweeted in that in India, for example, you do see large stockpiles of vaccines that are not properly distributed. And they're saying, you know, can you really be sure when you say there's no corruption in vaccines that the job is being properly done?
Well, you can make sure it's done a very high percentage of the time so that your impact per dollar is incredibly high. I don't think there's any money a government spends that's as nearly as impactful as what is spent on vaccines. And we're constantly surveying, looking, making sure all the children are getting covered. We're getting smarter about how to do that. And so I'd say it's a very well-run program, despite small imperfections.
Here's an interesting one. What does the Gates Foundation do, brackets, if anything, for those affected by poverty in the United States, Melinda?
Well, I think the thing that we can do the most for people in the United States is get people a great education. Make sure that all students have a great education. And that's just not the case today. If you go into the public school system, which Bill and I do now quite often across the U.S., there are kids that are being totally not served and left behind. So we're trying to make sure that we change the U.S. public education system
but
so
that's
that all kids have a great education.
That's not within the Gates Foundation, is it? It doesn't really fit your parameters.
No, it is. That is exactly what we do in the United States. So our largest funding in the United States is the public education system.
Why are you spending so much money on these drugs? Is it not supporting corrupt drug companies? One viewer asks, Bill.
Well, in fact, when the vaccines and drugs are made available for these poor countries, they're made available at an extremely low price. And there's a lot of competition. The low-cost manufacturers come in because the volume is very high, and we spend a lot of time making sure that the costs are very, very low. Now, the drug companies are important. They're key to helping us invent the new drugs, And so what they do is they try to make their money off of the more well-off consumers while offering a sort of break-even price for the poorest. And that balance works. We rank all the drug companies every year in terms of how much they're helping the poorest, and they compete because their employees care a lot about this.
I mean, Melinda, you are very much on the front line. Are you not uncomfortable with some of the performance of the drug companies?
I would actually say we're impressed with the performance of the drug companies. If you'd asked me a few years ago, would GSK be coming out with a new vaccine with specific strains around pneumonia that affect African children, I would have said, is that going to really happen? And it is happening. I just came from Kenya, and it took, where Bill and I, when we came into vaccines, it used to take 15 or 20 years from a vaccine to go from the developed world to the developing world. This new vaccine that's coming out, it's 2 years between the time it came out in a developed country to got to Kenya.
And what about,
that's impressive.
What about price and profit?
Yeah, actually, the pneumo vaccine, there was a commitment made to buy in volume to get a super low price. And so they offer it a fraction of what they're charging in, say, the United States, so that we can get it out to all the poorest kids.
I'm going to dip down to our last question, because I think it is a really good one. Melinda, to what extent does the Gates Foundation fund efforts of existing charities and NGOs and not duplicate work resources unnecessarily? So, sorry, I'll read that again. To what extent does the Gates fund efforts of existing charities and NGOs and not duplicate work and resources unnecessarily?
So much of the work that we do is through existing NGOs. A great example is Save the Children. We spend millions of dollars with Save the Children because we have a central mission that is the same, which is to help raise up healthy mothers and healthy babies. And they do a lot of this community behavioral change work on the ground that is absolutely imperative for saving a newborn life. We know half the deaths for children come in that first month of life, and Save the Children knows how to go after those moms and works in those communities. So they're one of our fundamental partners. And there's so many more. There's CARE, there's Oxfam, there's Red Cross. So we work through lots of existing NGOs.
But Bill, finally, you know, Microsoft, that's behind you, or it's still part of you, or are you living in a new world? Do you tweet? I mean, is your iPad somewhere down there in your left hand? What's your life now?
Well, I get to use technology to stay in touch, and that's fantastic. I've got 2 million follows on Twitter, and you know, I use that to get feedback from people what they're thinking about. I spend a little bit of time at Microsoft, and I enjoy that, but my full-time work is at the foundation. Now, the foundation's work is pretty technologically intensive, whether it's improving education or using cell phones to make sure all the children get vaccinated. I get to stay in touch and make sure we're using the latest technology to serve the poorest.
Of course, some of the ill-informed, Melinda, used to think he was rather geeky. Have you humanized him?
I don't think it's me that's humanized him, but I don't think that you can be out in the developing world and not be touched by what you've seen. And Bill travels extensively. We travel together and alone to the developing world, and I think you come back changed and touched by that, and I think that's part of what you're seeing.
Bill and Melinda Gates, it's a great privilege to talk to you. Thank you very much, and I know a lot of people are very grateful to you for what you've done to philanthropy and much more. Thanks a lot.